So AVID200 is a selective TGFβ 1 and 3 trap. It is an infusional agent that downregulates TGFβ signaling and has rationale and preclinical data supporting its use in myelofibrosis, probably by accomplishing two things in murine modeling and in primary cell work in the lab. One is by downregulating, TGFβ, I should say, is a negative regulator of normal hematopoietic stem cell activity, and inhibiting TGFβ releases that repression through reduction in phospho-SMAD2 and cyclin-dependent kinase inhibitor P57 expression, thereby reactivating normal hematopoiesis. But also TGFβ is a well-recognized pro-fibrotic cytokine. And many studies now have demonstrated that there's overexpression of TGFβ1 in patients with myelofibrosis, and that's thought to be, the source is thought to be MF megakaryocytes and monocytes and mesenchymal stromal cells. So there's a lot of rationale for blockade of TGFβ, and this infusional agent was taken into the clinic based on a lot of really sound preclinical work by Lillian Verrocchio, Annarita Migliaccio, and Ronald Hoffman, and others. And this was a phase 1b study evaluating 3 dose cohorts of this infusional agent given every 3 weeks. And there was no DLT seen with the drug. It was a well-tolerated, safe drug with minimal grade 3-4 toxicity, minimal related toxicity to the drug, and no infusional-related reactions. And what we saw at the 2 highest doses that were expanded in the 1B portion of the trial was some signal of activity. We had a patient so 21 patients altogether were treated, 12 in the dose expansion phase. And we saw anemia response in a patient. One patient had anemia, spleen, and symptom response at week 24. Another patient had a total symptom improvement of 50% or greater at week 24. But if you looked at best or maximal responses and changes in spleen and symptom burden, there were a number of patients who actually achieved symptom and spleen burden at some point in their treatment course. Unfortunately, none of the patients in 16 paired samples had reduction in bone marrow fibrosis grade, but there was a biomarker assay looking at both TGFβ levels. So there was significant elevation at baseline of TGFβ1, but not 2 and 3 in the patients who were treated. There was some variability in the height of elevation, but the drug did seem to suppress TGFβ1 levels in the majority of patients that were treated. And there was a hint in some of the cytokine expression analysis of reduction in inflammatory cytokines with AVID200 treatment, and some of that has to be explored further. But there was a clear signal of safety and a signal of clinical activity. I think the conclusion of our study was that this is a drug that is best explored further in clinical testing as a combination partner, either with a JAK inhibitor or other mechanism-based therapies, many of which have rationale in MF. That's a subject of our MPNRC consortium grant, and perhaps earlier in the disease process. So I think one of the things we've learned is that to use a drug like this, you probably need to use it earlier, and you may need a longer time point assessment for reduction of bone marrow fibrosis, and as again in combination with other active agents that can synergize.